Call to order the September 24, 2015 Regional Health District meeting, please. Let's have a roll call, starting with John, please.
John Snyder, Spokane City Council.
Shelley O'Quinn, Spokane County.
Chuck Hafner, City of Spokane Valley.
Keith Baldwin, appointed member.
Susan Boyson, appointed member.
Okay, stop just a minute, Susan. I have a picture here I'm going to pass around. Susan now is, you'll see, is Susan Boyson.
For 1 month.
For 1 month. It's absolutely a great picture. It's just absolutely a great picture. So I thought I would pass it, John, if you take it and then pass it around. And Susan, would you like to say anything in regards to that?
No, we're very happy.
There you go.
And actually, we met over Board of Health business.
Congratulations.
Congratulations. Okay.
That might leave a stigma.
Michelle Fossum, Legal Counsel.
Ann Kinsnoggle, Recording Secretary.
Mike Fagan, City of Spokane.
Bob Lutz, appointed member.
Todd Milkey, Spokane County.
Joel McCullough, Spokane Regional Health District.
Well, soon to retire person, would you like to say something?
David Swain, Director of Environmental Public Health.
Okay.
What are you getting at it? Kyle Lillen, Director of Health Promotion.
Okay.
Barbara Ryan, HR Manager. Linda Graham, Policy and Communications Manager. Oh, I'm sorry. Kim Kramar's County Manager.
You're computing there while you're sitting, is that correct?
Yes.
Yeah, okay, thank you. Okay.
Sheila Manstella, I'm the new Division of Director for Family.
Oh, okay. Okay, and let's see, that's Mike? Okay, thank you very much. Not seeing any, is there any citizen input? We'll continue then, and we'll start with with my report. I have very little other than the fact I did want to make sure that I identified Susan and what her marriage, and to make sure the name has changed. Also, at the same time, Shelley, I think you and I mentioned a little bit this morning. If you'd like to give us a status of where we are with the temporary fee schedule, please.
So we actually have a proposal based on several committee meetings. We started these committee meetings the conversation started back in January, but I think we met between March and July, had many meetings. Thank you to staff who've put a significant amount of time in this, even participating in some committee meetings on the other side of the state. And so this will actually come to us at the October board meeting because we've developed a proposal. I think it went to the executive committee. I'm assuming it did, but it's going to go out. We're going to have one final committee gathering to give the approval and okay. I think it's a good compromise, and it's going to result in lower TFE permits for some of our folks who are looking to be able to participate in events that were just it was unaffordable and out of their reach. So I do think we come up with a good compromise, and we'll bring it back to you for a vote at our next meeting. Okay,
and will the committee then be receiving some information regarding what you came up with?
Yes, my understanding from all of our meetings from our conversations is that I was going to send out an email. And I think I will, in my email, say if you want to meet, great. If you want to vote on it via email and just nod your head of approval. We've had lots of meetings around this. So if they want to get back together and discuss what was finally put together, we can. But I think just based on all of the feedback we've received, most people are going to give the nod of approval via email. And I don't think maybe, I guess if I could say, I don't think everyone's going to be completely happy in the sense that they achieved, it didn't go so far to one side that they're extremely happy or so far to the other that the other side's extremely happy. I think we have a good compromise, which makes everyone okay. Okay. So that's where I believe we are.
And it sounds good, but here again, respond to that, the people in the committee, and so that the next board meeting we can approve it at that point in time. So that'd work out.
And you'll note we did vote on, for those of you who might be confused, we voted on the fee schedule last month with a footnote that this would come back to you.
Right.
Because our committee had not finalized our version. And we've increased it to 1 day, 2 to 4 day, 5 to 21 day, and annual. So we've actually added more categories, and so we just had not finalized it by the last meeting. So You'll vote on it next month. Thanks.
Okay. Thank you, Shelley, for all your hard work. I know that this particular item has been in discussion for quite a while. If I recall, the first year, I think Todd, Commissioner Milkey, was leading that thrust at that time, and so it's nice to get some where we are at this point in time to be able to move forward with that. And I'm sure those citizens that for some reason the $480 hits me, smacks me, and where people are really concerned about any kind of a display or what they were trying to raise some money, and they never even came close to raising that in 1 day or 2 days. So I think it's a good move for us. Okay, Dr. Joel, please, Health Officer report.
This is the content of my health officer report today. I'll be introducing our new division director, who already introduced herself. We'll be talking about the all-staff meeting that we had yesterday at the Lincoln Center. Talked briefly about a CDC visit that occurred here in Spokane this week. There were some requests for information about a couple of different infectious diseases, so discuss briefly about that. And the governance committee asked for data on heroin usage in this community, so I was going to cover that as well. So Sheila Masteller already introduced herself. She's been with us since July 28th, and she replaces Elaine Connolly as the division director for CFS. And she comes up with us with great amount of experience and knowledge in the nursing world. And Sheila actually started her career as a public health nurse at the health district a few years ago, right? Only a few years ago. And so we're really happy to have her here, and she's going to make a great impact in our agency. I know that.
On behalf of the board, welcome. Would you like to say a few words? Okay, well, that's a few words, so you did all right. Okay, continue, Doctor.
All right, we had an all-staff meeting at the Lincoln Center yesterday. That was our first all-staff meeting here at the Health District for several years, and that's where all staff were there. And initial reports that the event was well received. We covered some key areas, including strategic planning, and we had an external speaker talk about the culture of poverty, and I believe that was well received too. So overall, good reports about that event, and we're looking to potentially continue that on a yearly basis. Regarding the CDC visit, the part of the CDC that's called the National Institute for Occupational Safety and Health, and their mission is to provide technical assistance to workplaces and basically workplaces with questions regarding worker health. The CDC was here to investigate the event that occurred at Pacific Steel last month. As you recall, there was a chlorine gas leak at the facility, and several workers in the facility and others in the surrounding area were sent to area hospitals. The CDC was here to understand what went on and potentially make recommendations in the future. So they were here for a couple of days this week. They're still gathering information, and hopefully we'll have more, depending on what that additional information looks like, we will likely get a report from them. So that is an ongoing investigation. Regarding the infectious disease briefs, there were questions about pertussis, whooping cough, and questions about influenza. Regarding pertussis, Mark Springer gave a report a couple months ago about pertussis, and talking with him a couple days ago, the numbers are still pretty similar to what he reported a few days ago. I think he reported only one case for the month of September so far, so we're not seeing huge numbers, but we know that pertussis is out there. So that's one of the diseases. Also, questions about influenza. The flu season has already started. We're seeing it at a low level still, which is a good thing, because the flu vaccine has just arrived, so people are starting to get their flu shots. And I guess the good news related to that is that it's anticipated that there will be a better match between the circulating strain and the strain that's in the flu vaccine compared to last year, because last year there was very low match between the circulating strain and the predominant strain. So it's anticipated this year that there will be a better match. And finally, there were questions regarding heroin data locally. This question came specifically from the governance group that met last week. A couple sets of data here. The first one is from the medical examiner's office. So we can see here that there have been, for the year 2014, this is last year, there were 73 drug overdoses here in Spokane County. And we're going to focus on the accidental drug overdoses, and that's the number of 64. And you can see here is the categories that they were listed in. 17% were a combination of illicit and prescription and alcohol. 2 were alcohol alone. 24 were illicit, including with methamphetamine. 20 were from prescription drugs only, and 1 unknown. So when we look at the trend, we can see that there was a peak in recent years in 2008 for drug overdoses, and the numbers did decline until 2013. Then there was a uptick in the year 2014. So this table shows the last 2 rows shows the prescription drugs and the illicit drug proportions. So they're almost even. Especially last year, 2014, the deaths caused by prescription drugs and illicit drugs were about the same. And when we look at the most commonly causes of death or contributing to death from the list of illicit drugs, for last year, methamphetamine was the most common drug listed as contributing cause of death here in Spokane County with 22. And heroin was the second most common with 7 deaths causing or contributing to death. Another source of data outside the ME's office is our own opioid treatment program. So this is the data that our counselors take when they enter the program. All the people receive an assessment, and this data shows that their main drug that they say they were using upon entering the program. And the first row shows heroin, and as you can see, from the years 2013 to 2015, there's a steady increase in the proportion of opioid treatment patients who say that heroin is their main opioid that they're using upon entering the program. So there is a definitely trend that we're seeing locally in terms of usage here for heroin. So, and that's all I have for my presentation.
John, do you have some questions for the doctor?
Yeah. I don't know, maybe I saw a report that was an error then, because they talked about there being, dozens of heroin deaths so far this year in Spokane County, and it didn't sound like that's supported by the data we have. This is the year for 2014. We haven't had the year for 2015 yet. Speaking with the medical examiner, at least off the cuff about this, and she mentioned that there wasn't anything unusual, but they haven't really published the results yet. So. Would they normally not do that till the end of the calendar year?
The reports are generally not done till the end of the calendar year.
So we would know more than whether we're seeing kind of an increase or not.
Right. In terms of deaths, that's correct.
Okay.
John, does that answer your concern? Because I know you were asking about. Anybody other questions? Keith?
I've had a couple of questions from people about the strength or longevity of the flu shots. There's a lot of people who come and ask about whether they should get a flu shot or not. Right. Some people are concerned about how long it lasts. Can you give us any information on sort of the lasting effects of a one flu shot? Is that a 6-month, a 9-month protection?
Well, according to CDC, the flu shot will last the entire flu season. So if you get one now, it will last. Your immunity will be for the entire flu season.
Okay.
But as you know, it's recommended that you get a flu shot every year because the circulating strains change. So there's no danger in getting a flu shot early in a season and worrying that it will wear off by the end. So that is not the case.
So for seniors especially, there's no reason to worry about getting a booster late in the season or something like that if they get it now.
There's really not a recommendation for a booster. What we have for seniors is a high dose flu shot that's out there. So it will give, it's 4 times the amount of flu antigens that's in the shot. So the hope is that increased dosage will boost their immunity better because the seniors generally, their immune response is less. So the idea is that giving the higher dosage will boost their immune response adequately, but not to get another booster.
Thank you.
Okay. Commissioner Melky?
Thank you. I want to go back to your data with regard to the drug use. Do we have the ability to look at, your data focused on deaths as a result.
Right.
Do we have the ability to also look at like ER visits in the Spokane region based on overdose and then try to categorize?
Yeah.
And the reason I ask is I know this is something that the Spokane Regional Law and Justice Council is looking at. We've had this ongoing dialogue about underlying circumstances with regard to the criminal justice system, and we recognize that substance abuse and mental health issues and then the co-occurrence of the two are a huge driving factor in the numbers that we see. And we keep hearing these things about an uptick. But I'm not sure if we get the full picture only by looking at the deaths, or if we can also, like I say, take a look at the ER visits and look at both data sets.
Yeah. You can get data from ER usage as well. I think one of the challenges is that here locally that there's been kind of a separation of the different systems with INHS not being that central hub for data. So the individual health systems have their own data. So, but generally speaking, we can look at the ED data and determine rates there as well. So that's correct.
Can we get that information? Is that what you're requesting?
Yeah. I think we as the health district, you're right. It's a little bit more difficult to get the information, but I think we're mostly still comprised of 2 hospital systems cover, I would say, the overall. I'm trying to think do we have any ER rooms outside those 2 systems? I don't think they're showing up at minor emergencies. Maybe, I don't know. And so maybe between the 2 systems, I'm just thinking if we could be the convener of the data, just like I say, as the regional health district, because I do think it's a public health issue.
Okay. Would that be possible to look into that?
So what is the request? Is a request to look at ED, to obtain ED data specifically related to opioids and heroin? Is that
to drug overdoses? I don't.
Drug overdoses.
I'm sure that I know enough to be more specific than that.
Okay. Yeah, I think I got it. So I can.
Okay. Good. Thank you. Any other questions, Mike?
No, actually, just a suggestion, Mr. Chair, as well as Councilmember Snyder, since Councilmember Snyder does chair our Public Safety Committee there at the City of Spokane. But I think that Commissioner Milkey is definitely on the right track in trying to do a little bit more of a drill down so that all of the rest of the Board of Health members here would understand the problem. Now, we know that bulk heroin, cocaine, and meth does not come from the immediate area. It comes from outside of the area. And my suggestion would be one that it may be beneficial for public safety or the Board of Health to reach out to the newly formed Safe Streets Task Force, which used to be known as the Regional Drug and Gang Task Force, so that we would have an understanding as to where this stuff is coming from, who's bringing it here, and at what kinds of volumes. we're also looking at. Now, I realize, they do have ongoing investigations and things like that, but I think that we could get a pretty decent 30,000-foot view of the problem or an anticipated problem if we have an understanding as to how much of this material is here in the immediate area. Now, in addition to that, I do know that there are several media agencies right now that are standing by and will hold on to this information, but we have seen a resurgence of casted away needles in our parks in the city, in East Central, West Central, Hilliard, and I'm sure that it's happening in other neighborhoods here in Spokane, needles in our playgrounds and our parks. And, talking with the media outlets there, we are working towards some type of a public education and awareness campaign, but we want to be in a position to message it such that we're not scaring the public out of, using our parks and playgrounds. So, again, just wanted to offer a suggestion that this body and maybe public safety get some kind of a briefing from our Safe Streets Task Force.
Okay. And is John concerned with that also? The safe street concept? Were you involved in that?
Well, just in the sense that it's a joint program of the City of Spokane Police Department with other law enforcement agencies. It's it's a new name, a little bit different than it was before, and I think that information would be helpful. I was just re-looking at the KXLY news feed, and it said that overdose deaths, or overdoses were spiking in Spokane County, but they didn't provide any detailed information about that. They basically quoted Ms. Papich and just talking about how they see some information that heroin use has increased and kind of created a headline from that. And that's one of the reasons why I wanted to get some more information from Dr. Joel. But I agree with both Commissioner Milkey and Councilmember Fagan. It would be good to get more of this information. Otherwise, we ended up being on a reactive level policy when a problem does occur. And I know other parts of the United States have had a big problem.
Okay, Commissioner?
Well, and my thought in all of this is how we become proactive as a community. I mean, the opioid treatment program we oversee as a board. We always try to measure what the demand is, and so as we plan for next year's budget and where to put our resources, limited resources with regard to the health district, we try to get a sense of what that looks like. I know that we've had some high-profile deaths in the jail in this calendar year, and I also know that. Without disclosing too much information, that almost every one of them was related to drug use, and so that's the kind of way I look at it. And I think, yes, I want to know where is it coming from and in what volumes and all that. But I also look at this as when we look at and think of our criminal justice system, we have those that I guess recycle in the system. And we're trying to reduce recidivism because we think that's where there's a huge public frustration. When you pick up the newspaper and you say, gee, this person was arrested, they've been arrested 22 times in the last 2 years, they're still waiting trial on their last 2 arrests, and they were arrested again, and I think the public goes, why are they even on the streets, kind of deal. And so I think part of this is how do we break the cycle for those that are already in the system? And oftentimes what we find is there's an underlying substance abuse or mental health issue. The other thing that we talk about a lot is kind of the school to prison pipeline, which is for those that fall out of the ranks of the education system. Oftentimes they find themselves mixed up in the criminal justice system. So how do we break that linkage so we're not, I guess, feeding a new supply of individuals to the criminal justice system? And I think, Mr. Fagan, that goes to your comments, which is how do you have great after-school programs? How do you try to keep them away from this? So part of it is those that are already caught up. How do we break the cycle? And then how do we try to close the door on those that aren't there yet, and we don't want them to be there? And so, like I say, for those that are recycling in the system, I've talked to a lot of judges that say I have no place to put these people when they come before me on first appearances, whether it's an inpatient placement, whether it's an outpatient placement, or whether it's some alternative program that tries to address those underlying ones. And so I think this is kind of where I'm seeing some of what the health district does, kind of overlapping with what we're seeing in the the criminal justice system.
Do you have some suggestions how we should proceed from here?
Well,
It seems to be there are a lot of questions
evidence-based.
and concerns. We need to either set up an ad hoc committee or
Right.
through the health district or whatever. So if you have some ideas, let's
Right.
follow through with it.
Certainly, I want it to be evidence-based and have the data guide our decision-making. I think that's first and foremost. I think that that depending on what the data shows us, if it shows that we have a large unmet need for helping treat those with substance abuse issues, and it's causing additional negative effects in our community, whether it's the criminal justice system or others, then should we look at expanding our opiate program, should we be incorporating more public education? One of the things that I think is probably more distant is, and I don't think there's any data collected on this so far, is I don't know if it's too early to begin to see the effects of legalized marijuana in the state and whether it's having any other ramifications with other illicit drug use. And I don't know that we will know that for a number of years out
Right.
yet.
We're noting some of that at the high school level already, so it's coming forth. Dr. Lutz, do you feel that the Education Committee would look into this and start some initial processes to continue? Means you're chair of the health district. I mean, of the education.
Let me ask my
committee.
co-chair, Dr. Boyson, what do you think?
Okay. And with that in mind, you won't have to be on the governance committee at this point. You can kind of go on your own. No. Okay. All right. Any other questions or concerns? Okay. Thank you very much. Thank you, Doctor. Linda, please. Before Linda starts, Keith and I attended a workshop, and the title was Linking Transportation Planning and Health Outcomes. And it was a very informative workshop. I know I had to leave early, but Keith was there for the full amount. And I don't know if you might want to say something in regards to the workshop. And then I do want to congratulate Linda because she played a very important role in the presentation, and she did an excellent job. And once again, I can simply say congratulations. They represent us too well that we feel very proud of being on this board. But would you like to mention anything at all? You're not prepared, I know that, Keith, but I covered. Okay, anything you'd like to add?
No.
Okay, Linda, thank you very much.
All right, thank you, Chuck. And in regards to that conference, shout out to Helene from our Healthy Communities department who helped put together the agenda and put together that whole meeting. And it was a really great opportunity for me to go talk about a project that we've been working on within the health district to really design a standardized process and some tools for how we are going to do our policy analysis work as an agency, and we will be bringing those forward to the whole board and sharing with you at some point. So, probably a quick report today. I just wanted to begin our legislative agenda development process. Just a quick reminder, the idea is that in September I bring forward just an initial list of ideas that are based on talking with our programs, our division directors, talking with various partners in the state, including Department of Health and WSALFO. And then the idea is to then get some input from you of what you might want to have on the agenda. And then we'll come back in October and refine the list a little bit further, provide you with additional background on anything that you might need information on. And then in December, you will vote on a final legislative agenda and put it in the form of a resolution. So this is just the start of the process. Quick reminder about last year's agenda. This is actually kind of a starting place for this year's agenda. Did make some progress on 3 of the items, but certainly still work to do on quite a few others. So starting with those in developing your legislative agenda for 2016, I included the e-cigarette regulations that were out there last year. This was requiring licensing for the sales of e-cigarettes and e-cigarette products, putting in license fees with that, fines for selling to minors, just basically putting it in the same kind of structure that we have tobacco products now. Immunizations, there's been some efforts to get to eliminate some of the criteria for not having immunizations by the time you enter school, paid and safe sick leave, mental health and chemical dependency reforms, distracted driving legislation, which would basically make it a first offense for distracted driving instead of making it one of those secondary kind of things. And improving access to oral health services. Last year on your agenda, it was a very specific item related to mid-level dental providers. This year, there's actually quite a bit of talk of lots of other things that might expand access to oral health care that are out there, including the mid-level dental providers. That legislation is still alive. But they're also looking at some other things like a statewide oral health director in the state, and also there is a capital budget item that's being explored that would expand here locally the facility that does training for oral health professionals, and that it would allow for then additional students to be in that program and have a particular focus on having those students then remain in rural areas for their practice. So that's kind of my initial list out there. Would appreciate any input on that or any other ideas for legislative agenda items that you might want to explore further.
And could you, the e-cigarette regulations, I know that's becoming more of a concern, especially at the high school level.
Right.
Having talked to many high school principals relating to that, and so I'm not sure if we have to define that more closely of what exactly we're going to need and why we're going to need it. Because here again, it's getting to be really a serious problem.
Yeah, and this really is putting the regulations in place at the state level. Like I said, very similar to how tobacco is regulated. So you have to have licensing to sell it. Then that funding then provides for people to go out and do compliance checks, because then we know where the facilities are. We have the funding to go out and do compliance checks, make sure they're not selling to minors. There's also the fines for if they are caught selling to minors. There's I can get you the whole page of all the pieces that are being proposed under the e-cigarette regulation. Is it everything that's needed to solve the problem? No, because there's also additional education that needs to be done. We do have a program here at the district that is specifically focused on looking at e-cigarette issues and particularly youth use. But the e-cigarette regulations is certainly a big piece of trying to really hone in that.
Okay. Any questions, Keith, or ladies first?
Well, I was looking at the summary sheet that you gave us.
From last year?
Well, it says summary of public health related bills in 2016 legislative session.
Right.
So for next year?
Oh, sorry, that should say 15.
Okay.
It was summary from last year.
But this isn't everything that we supported last year.
No,
this
is things beyond your legislative agenda. I just want you to know all the different kinds of public health related things that were.
Okay, because when I look at this is too broad. I mean, we need to, as an organization, hone it down to, if we're going to be effective, this is throwing a whole bunch of things at the wall and hoping something sticks.
Yeah. No, it was education about how many different things are out there. I was not proposing that is your legislative agenda.
When I read the 2016, I was thinking, wow, this is not going to work. So.
Any other, Keith?
Linda, I know I just received not too long ago the Providence, and didn't the Regional Health District also participate in a community health assessment process? Have you seen that yet?
What are you referring
to?
What are you referring to?
The community health assessment done by either Providence or the health district. I saw it come out of Providence because of their grant process, but I just wanted to reiterate that their three highest issues, obviously, were oral health access, mental health, and chemical dependency. And I can't remember the third thing, but they're much more specific this year than they were last year. Might it be helpful for all of us to see that document just as an add-on or part of the education process of trying to figure out what the needs assessment said? The other thing I was a little concerned about is because of the heroin discussion we had the other day and the opioid issue, hospitals have been working on that opioid issue through the ER for a number of years through several different programs. So there's been a lot of work done there, but that's really only hospital specific. It doesn't get to all the other providers in the community like optometrists and other folks who are using opioids. And I'm wondering, does that whole opioid issue come under chemical dependency reforms, or does it also need to be listed somehow? Because access to stuff, as Mike mentioned, is half the problem. But it's also a lot of our providers still give out a lot of opioids. I mean, a 90-day supply of a strong opioid after you've had a tooth pulled, probably an overkill, but it happens every day. So I don't know. I see that somewhere up here, and maybe not an isolated topic, but somewhere part of something else, because it still is a real problem in the community.
Yeah. A couple points in regards to Providence and their priorities. A part of what goes into bringing some of these ideas forward is talking to various partners, and they were one, along with Empire Health Foundation, Better Health Together, Wasolfo, DOH, all of those. Right. In regards to opioids, if the board is interested in having that as a specific item, that's certainly an option, if you want to pull that out.
The board want that?
I'm interested. I mean, being somebody who got prescribed way too many opioids than I needed when I had 2 different knee surgeries, I totally concur with that. I mean,
it hasn't changed.
Yeah, so I don't know what's there, if there's what the policy is, but that's interesting to me.
I guess that's what I'm not sure what exists out there right now. I mean, I know, having been out of practice and back in practice, we're a lot more cautious. I mean, I think within what I'm seeing in the system right now, we're a lot better than we used to be. Now, that's not saying there's room for improvement. I guess I'm not sure where we go with it, however, other than educating providers and practitioners. I don't see it as a policy per se, I guess.
I think the issue would be to collaborate with other agencies that do have influence over places in our community where access is still too easy, too free-flowing, that sort of thing, because obviously we haven't gotten at it yet. Right. So it wouldn't be something necessarily that we would do only as a health department, but clearly we could collaborate with other groups to make it a more
higher profile
item is all I'm saying at this point, because we're just sort of looking at stuff. And I'm sorry, Joel, I didn't mean to interrupt.
Well, I was just going to offer that one possible thing might be more resources for destroying prescription drugs. That's the other thing, is you get way more than you need, and you don't want to flush it down the toilet because you don't want to, I don't know, give it to the fish. But there's not real easy ways to get rid of it. So maybe that's part of the policy discussion. I don't know.
If it would be helpful, I can provide some information in terms of what's happened and what's going on at the state and federal levels, and what's been some of the work that's been done here locally as well, because there's been different initiatives that have taken place, and I think it would be beneficial to learn what those initiatives are and what will be upcoming. So I can totally.
So why don't we start there with the information, and then we can determine what direction we want to go after we get all the background stuff. Does that sound reasonable to everyone? Mr. Fagan?
Thank you, Mr. Chair. As a matter of fact, in answer to Councilman Snyder's comments about feeding the fish drugs, I did see an ad in the Spokesman Review this morning, and I do believe that it was placed there by the DEA, who is hosting some type of a medicine or medication disposal event. So you might want to reach out to the DEA and see if we can have a little bit of a discussion.
Well, I thought that the fire stations, different fire stations throughout the valley, I know, had a certain day when they pick up all medication.
Yeah, they do direct.
Is that what we're talking about?
We talked about this last year, and there were a lot of rules that Dr. McCullough related to us about why it isn't just an open-ended thing. It is a one-time event usually, or 2 times a year, but there's lots of rules around it, and we reviewed this last year once, but it clearly should be a part of the whole process.
well, let's review it again if it's a concern and see what direction we can go. John?
Just in response to Linda's question about agenda items, I think, those are some really good ones up there, and most of them have some unfinished business from last year. On your list, though, a couple things jumped out at me. I noticed there was 2 relating to students, public school students, the Educational Opportunity Gap Bill, 1541, and then also the Homeless Students Bill. I don't know if there's a compelling public health angle there, but it seems like there would be to me, because that's one of our only chances to get health services is if a kid is somehow connected to the school system. And having dealt with a lot of policy that's dealing with homeless kids in our downtown area and stuff, those 2 look intriguing to me. I don't know the reasons and what behind them. And then the other one I would just add is, it's not on here, but I would think there might be some public health interest in strong funding of the Housing Trust Fund, because so much of our Housing Trust Fund money seems to go to projects that are like transitional housing or housing for folks with other medical or substance abuse health-related issues. So those are just my 2 thoughts.
Okay. Well, there is a group that was organized around school health. There was a project developed out at Airway Heights where there was an actual clinic in the school. So if we want to know more about that, we should probably get some feedback on that program and where it's going. Because I think they were just starting out with a pilot and then trying to figure out how effective it was and whether there would be future funding for it. But I believe it.
Yeah, it's the school-based health clinic at Sunset Elementary, I believe.
Yes.
Yeah.
Oh, and Fairchild.
And just kind of in general, in terms of the 2 ones related to students and homeless students in particular, they were on the list because we were watching it, because it does relate to some work we are doing in the health district, particularly connected to Priority Spokane, and their particularly their latest priority that they're working on, which has to do with homelessness and mental health issues and students and how that affects dropout rates and those kinds of things. It's certainly something we can put on your agenda if you're interested. And one of the criteria we've developed in terms of what goes on the agenda has to do with, does it really impact the work of this health district and what we're doing here? So it would fit.
Okay, Commissioner?
So just a few thoughts. One was, to me, the list is kind of throwing everything up. I don't think today we're prioritizing.
No, it's basically just throwing out ideas and going from there.
Is your mic on, Todd?
It was.
There we go. Thank
it
you.
Was. The second thing is, I would be also interested in finding out what the State Department of Health is doing with regard to their legislative agenda, to make sure that we're consistent. I know that last year they were looking at a multi-year kind of legislative plan for the foundational public health services concept, which was kind of reorganizing, the way that we look at public health. What are those core services that should be provided in every community anywhere in the state? So I'm kind of curious where they're at, what they're doing, and whether we dovetail with that. So that's number 2. Number 3, I think with regard to the school programs, Chuck, you're probably one of the best people to speak to this, but I'm just assuming that right now, from a spectator's perspective, I see this ongoing battle between the legislature and the Supreme Court about what's basic education. So I don't know if the discussion about additional services in the schools, how that's going to be met by either the schools, the Supreme Court, the legislature, or anything like that. So I just think that one's going to be kind of a hypersensitive issue to some parties until they figure out the whole basic education piece. The last thing I was going to mention, and I know I mentioned it last year, and I think we should have it basically every year, considering it wasn't that long ago that one of the articles in the newspaper was that of the money collected from marijuana sales in the state, that Spokane County is generating more than anywhere else in the state. And I still think that The legislature's response is, well, show us that you're incurring costs. Where's your nexus? I don't think they can show a nexus of why they're receiving the money either. But I think if anyone can show any potential nexus, it's health districts and health departments across the state. And so I think we should continue to have the dialogue that says a portion of marijuana revenues as a general revenue stream should go to public health agencies across the state, and not define it they attempted to plug it into silos, say it could only be used for education pertaining to marijuana. It's a general revenue stream. I think it should generally go to public health. And so I think that's one that we just need to keep plugging away at.
To answer your question about DOH,
yeah.
In my discussions with them, a couple of things. It's a short session this year.
Mm-hmm.
We do have some pretty large fights going on about other things. Their real focus is going to be on the e-cigarette regulation and on immunizations, and that's pretty much it.
Right.
They are going to continue to refine the work around the foundational services for public health and go on with that in 2017.
I know last year their first priority was, and I know attorneys and others have been heavily involved in this discussion, was to get the legislative buy-in on the concept and the notion that you create kind of a master account for public health. So if you can get the legislature to buy in, should there be a baseline of public health services offered in every community across the state? And should we create this master fiscal account for public health purposes? And then once you got legislative buy-in on that, then I think the next step was which revenue stream should be directed to filling that account. And so I think they're somewhere between kind of step one and step two, which they're still pushing for legislative buy-off and consensus that this revised concept of public health is worthy. The establishment of the account, and then like say transition into identifying what are the specific revenue streams and at what levels that should be feeding the account. So, but yeah, that's just my general understanding.
You're asking Torney?
Well, I can tell you that the technical committee has been reactivated. It will be meeting every 3 weeks, so that will provide more feedback to the committee that you co-chaired.
Right.
Okay. And Mike, I think you before Shelley, and then.
Thank you, Mr. Chair. I definitely agree with the Commissioner that this is worthy of further discussion, but I just wanted to let everybody know, both myself and Councilmember Snyder just got done getting briefed by our finance guys, and looking at the 2016 budget to the best of their estimation at this point, and this is a conservative number, what we may anticipate seeing from the state in revenue sharing in the city of Spokane, knowing that we've got our share of retail outlets, is a conservative estimate of $75K in 2016 and very possibly $100K in 2017. So we're not talking about a whole lot of money. And again, that's just a conservative estimate.
Yeah, they keep revising the estimate of total collections up and up and up. The state legislature does. Their proposal, I think that they arrived at last year, was that local governments, combined cities and counties, would get a total of 3% each year. Of 3%, half of it would go to a city's fund, half of it would go to a county's fund, and then you divvy it up from there. So basically, for calendar year 2016, 1.5% of the revenues gets divided amongst every city in the state, and 1.5% gets divided amongst every county in the state. So yeah, it's 3% per year.
Nothing.
Okay. Shelley?
So it's been alluded to several times that different agencies are limiting what they're focusing on to one or two items. And I would encourage us to do the same thing. It is a short session, and we're not, as we look at these, we should probably decide which ones are we going to do some groundwork for the following legislative session and which ones are priority items. And it would seem to me that one of the most important ones would be public health funding and protection of up there, and whether that's marijuana strains or whether it's just general public health funding, because we've seen cuts, significant cuts, as they've found other places, i.e. school reforms, to put their money. So I'd encourage us to focus this year, because we're hopefully going to only have 60 days to deal with it.
I think we're all agreeing with that, too. Any other questions you might have? Jan?
To Shelley's concern, maybe, Linda, next time we touch this, could you help us understand which of the things that are left over from last year kind of got the farthest? Because it seems like those, if those have gotten pretty far in the previous session, they may be worth focusing on in the next session because there's more likelihood we'll get some movement on them.
Sounds good. Okay. So, yeah, I will be back in, if I can get this to go one more, October with putting all these ideas together. And we will spend a little more time looking at some criteria that we had developed previously about how we decide what ends up on the agenda. And some of those things have to do with previous effort and how far things got, impact on the district, those kinds of things. So we'll go through these next month.
Okay. Anything else, Linda?
No, I'm good.
Any other questions? Okay, thank you very much. We now go to the consent agenda. Do I hear a motion to accept the consent agenda as presented to you? Second? Second. Any discussion? Hearing none, all in favor, signify by aye.
Aye.
Those against? Thank you very much. Next, we have reports that Councilman Snyder is going to provide for us. So, John, you're on.
All right. So if you will recall, 2 years ago, we formed the Board Governance Committee. This board formed a governance committee and tasked it with looking at ways to improve the board's governance. And we spent a whole year working on that last year. And that committee consisted of myself, Mr. Baldwin, Councilmember Hafner, Mr. Lutz, and Commissioner O'Quinn. And I thought we had a really productive year looking at a wide variety of items on how to make us more effective as a board and engage board members and get them to participate. One idea that came out of that was the creation of a policy committee. In the past, when the health district has wanted to tackle an important policy, it's been pretty largely staff-driven. Staff would identify a need and just bring it forward to the board. And there wasn't as much participation from board members before a policy was kind of in an action mode. So one of the suggestions was to make that a little bit more board-driven. So we formed the policy committee to go over possible policies. And here we're not talking about legislative agenda, federal agenda. We're talking about things that the health district does on a local level. For example, the health district in the past has been involved with the helmet laws for bicycles, smoking in public places, those types of things that we have a direct impact here on the county that we do. So the policy committee has been meeting for the last several months and looking over things to suggest to this board to tackle in 2016. And we will, at a later date, come up and talk to you more about some of those other policies. But through 6 months of this year, one policy really rose to the top, and there was a pretty general consensus that this is something we should consider embarking upon, and that has to do with e-cigarettes and the vaping concerns. You have in your packet some details about what the concerns are with these devices. I will tell you at our policy committee meetings, the concerns ranged from the fact that these are treated differently than cigarettes to we don't know what's in them. For example, a vaping device can very easily include marijuana or other drugs, or it can include non-controlled substances of very dubious origin, perhaps manufactured outside this country to standards that we have no idea what they are, and they're really not regulated in every way. So that's a public health concern right there. And then Mayor Freeman also brought up tension in the workplace being an issue where there's no clear rules. People may be vaping in their cubicles, inside buildings where people who smoke cigarettes are not allowed to. It creates kind of a double standard, which creates some tension in addition to the health concerns. So there was a general feeling among everybody on the policy committee that this really deserved a deep dive by the health district, and with the goal of treating e-cigarettes in a similar manner to how we do regular cigarettes, which means they would be banned in public places, in schools, in offices, in places of business, and would need to adhere to similar regulations that we do for cigarettes now, which would be 25 feet from an entrance and so on. Especially since the secondhand inhalation effects are also really unknown. So it was important to me that we bring this to you, this meeting right now, before we embark on this process. If there is strong opposition from the other members who are not on the policy committee, this is a good time to discuss it. Otherwise, the way the process would work is we would embark on creating an outreach plan. That's the first thing. We would make sure to have really good public involvement. We would start to schedule that public involvement. And this board would not make a decision on whether or not to pursue a no vaping or no e-cigarettes in public places policy until we've had some vigorous discussion and good public input. And the timeline for us to vote on this would not be until February or March of next year. So it's not a decision that would be made right now. We, like all things the health district does, we want to make sure we have the appropriate public input before we go forward. But the policy committee thought this was a really good initiative for 2016, so we wanted to present it to you today for your thoughts.
Any questions for John? Would you want that as a motion to move forward, or consensus be good? What do you want, John?
So, a motion would be great. It's not totally necessary. If there's a motion to stop it, I definitely want that now, because I don't want to have the health district staff do things that's not at the will of the board. But a motion to support creating the public plan would be excellent.
Well, either a consensus. I think we're all in favor of you moving forward. This is again a project the board can provide for the health district, and I think it's important. And I know vaporing is getting to be a very, very serious problem, so I think we need to look at it. So is there anybody that would not want John and his committee to move forward?
No, I'd be happy to hear that motion.
Thank you very much.
And I just want to thank Council Members Fagan, Council Members Pace, Mayor Freeman, and also Dr. Lutz for serving on the policy committee and helping us get to this.
Okay, thanks, John. We now are going to have a board member check-in. We will be going into an executive session after this particular section. So anything that anybody would like to bring forth for the best of the committee, for the council? Anything?
As I've mentioned in previous meetings, I sit on the Adult Behavioral Health Task Force, which is, we've been meeting for almost 2 years looking at the integration of chemical dependency and mental health services, and then for next year, and then as we go out, look out to 2020 with the integration of physical health as well. And those meetings are typically on the other side of the state, but we were able to do some arm twisting and convince the chairs to hold the October meeting here in Spokane. So that meeting will be October 16th. It's an all-day meeting, starting, I believe, at 9 and going until 3 or 3:30. And so I can make sure that information gets sent out. But if any of you are interested in the work of the task force and want to join us, you're welcome to.
What day is that, Monday? Tuesday?
It's a Friday.
A Friday.
Yep.
And just send out an email to everybody.
That's
Correct.
what I was going
I
to
can do
suggest.
that, but just want to make sure if any of you have that interest, we did get them over here. So,
Okay, thank
which is
you.
nice.
I have nothing at this time. Keith? Nothing? Okay. Anyone?
Just a couple of things. First of all, the second week of October, I'll be participating in the annual statewide public health conference in Wenatchee as part of a panel on the foundational public health services. So I think I'm Monday afternoon, I think. So we'll be doing that. Also, want to just give kudos to the district and staff. The public information campaign on, is it Healthy Spokane? I don't know what we call it, but the Healthy Life. I'm seeing those. They look great. So so that's all good. I know that over the last few years, we've had these discussions about, how do we go after a healthier lifestyle? How do we go after obesity? All those kinds of things. And I like the approach. About the only thing I was thinking is, I don't know if any of them, have said, since diagnosed with type 2 diabetes, I'm working on this and that kind of stuff, so we can actually start tying it specifically to some of the concerns that we saw as far as increasing public health issues. But again, kudos. Looks great. I think they look well done. The last one is a question, and I guess I need a reminder. Do we meet the fourth Thursday of the month, or do we meet the last Thursday of the month? And the reason I ask is my October calendar. I have our health board listed 2 weeks in a row, and I'm trying to figure that out because one of those I'm supposed to be in Olympia. Is it the last, or is it defined as the fourth?
Last.
Okay, then I have a conflict in October.
And Todd, I would like to make a kudo to yourself, is that in all the years I've been involved with the health district, you have been a very good force in public health education and what we're doing and regulations, and it's nice to have you back with us.
Thank you. It's good to be here.
Thank you. Any more board check-in and anything? That being the case, Michelle, it's up to you, please.
All right, so the board is moving to executive session pursuant to RCW 4230-144, which actually makes exempt from the Open Public Meetings Act discussions relating to labor negotiations. And so I understand we need about 10 minutes for that.
Okay, and we will start at 1:25, approximately 33. And so we'll meet in executive session here. So I would request that those in the audience will call back in order later on. So thank you very much.